Which of the following is the most appropriate next step in managing this patient's renal condition? So 55-year-old, history of hypertension and diabetes, admitted to the hospital with severe infection. He's been receiving IV antibiotics, but his condition has worsened. Now septic shock. He is oliguric, and his serum creatinine has increased from 1.2 to 3.5 over 48 hours. Fractional excretion of sodium greater than 3%. Blood pressure 90/60. Fever of 39.1. His urine output has decreased to less than 20 for the past 6 hours. So, okay. History of hypertension and diabetes. He has an infection. He's been receiving IV antibiotics, and the condition has worsened. So I think maybe he has had like some kind of, well, he's been in the hospital. So maybe the antibiotics caused damage to his kidneys, or he's dehydrated. Probably like a combination of things. He's oliguric, serum creatinine. So he's like, his kidneys are not doing well. His low blood pressure. Urine output. Most appropriate next step in managing his renal condition. So we want to make sure we kind of preserve what we have. So we need to make sure we're getting enough to the kidneys, and also the kidneys can function. So I don't think I would start with a diuretic, the furosemide and IV mannitol. He's 90/60. He probably is dehydrated. It's not like he's holding on to water or fluid. So with our low blood pressure, are we just not getting enough to the kidneys, or are the kidneys damaged? That's the question. I think it's B or C, but
Okay.
is it dumb? Like, I assume he's been getting IV fluids and some type of pressor, and if he's in shock, but
You never, you can
never
never,
assume.
yeah, never assume, right? Like,
Yeah,
don't assume. If the information is not there, then it's not there. You get what I'm saying?
yeah, I would go with C.
Yeah, great. So you definitely for sure you want to start fluids on this kid. I mean, this man, I guess, right? So he's an acute kidney injury. You need to increase his fluids, right? He's not having enough fluids. He's in septic shock, right? And of course, right, pressors can help maintain adequate blood pressure. So because he's such in shock, right? Of
Yeah.
course, starting pressors has its own side effects, like you can have extremity necrosis and things like that. But you got to save the body, right? So pressors here are important. IV flu is super important, but furosemide, right? That's going to just make him even more like, you make him pee, but you're going to make him more dehydrated, which is,
Yeah.
not great, right? Hemodialysis, in severe AKI, but you want to start with fluids at least first, right? So not going to start there. ACE inhibitors, right? Not really indicated here. It can actually make it worse. IV mannitol, right? It increased, treatment for increased intracranial pressure. But it doesn't, you don't really use mannitol in any other sense. So best answer here is going to definitely be IV fluids and vasopressin for to keep the blood pressure up.
Okay.
Great.